Hello everyone, welcome to Aanvii Hearing. Today I'm going to talk about some diseases causing hearing loss. Hearing loss is a common problem that affects millions of people worldwide. There are numerous factors that contribute to this condition, including disease. In this podcast, we'll explore some of the most common diseases that can lead to hearing loss. Otitis media. This is an inflammation of the middle ear and is often caused by a bacterial or viral infection. Symptoms include pain, discharge, and hearing loss. Otitis media can be treated with antibiotics or ear drops, and in severe cases, surgery may be required. Meniere's disease. This is a disorder of the inner ear that can lead to hearing loss, vertigo, and tinnitus. It is caused by an abnormal accumulation of fluid in the inner ear. There is no cure for Meniere's disease, but treatment options include medication, a low sodium diet, and surgery. Presbycusis. Now, this is an age-related hearing loss that occurs as the ear's natural aging process causes the hair cells in the inner ear to deteriorate. It's a gradual process that occurs over time and is one of the most common causes of hearing loss. Otosclerosis. This is a genetic condition that affects the bones in the middle ear and can lead to hearing loss. It is caused by an overgrowth of bone that prevents the proper movement of the ossicles, which is the three bones in the middle ear. Surgery is the most effective treatment option for otosclerosis. Mastoiditis. Mastoiditis is a potentially life-threatening condition caused by an untreated middle ear infection that spreads to the mastoid bone. If the mastoid bone, one of the most critical components in the inner ear, is not addressed, it can cause ear pain, fever, and hearing loss. Hyperacusis. Damage to your inner ear or hearing apparatus causes this illness, which can be debilitating. This disease causes hypersensitivity to sound, causing the victim to perceive everyday sounds as uncomfortably loud. Labyrinthitis. Labyrinthitis is an inner ear illness that occurs when the vestibular nerve gets inflamed, causing tinnitus, balance issues, and vertigo. Viruses and infections are two common causes of labyrinthitis. Otitis externa. This ailment, often known as swimmer's ear, is an inflammation of the ear canal. This illness can be transient or persistent, and it can be caused by a bacterial infection or allergies. It can cause ear pain, hearing loss, and in the worst case scenario, a fever. Caustic neuroma. This is a rare type of tumor that grows on the nerve that connects the ear to the brain. It can lead to hearing loss, balance problems, and facial weakness. Treatment options include observation, surgery, and radiation therapy. Other factors that may cause hearing loss. Ototoxicity. This occurs when certain medications damage the inner ear, leading to hearing loss. Exposure to loud noise. Regular exposure to loud noises such as concerts, industrial noise, or loud music can cause permanent hearing damage and lead to hearing loss. Trauma. Head trauma, including head injury or skull fracture, can cause hearing loss. Family history. Hearing loss can be hereditary, and if there is a family history of hearing loss, it is more likely that a person will develop the condition. Smoking. Studies have shown that smoking increases the risk of hearing loss as it causes damage to the delicate hair cells in the inner ear. Noise-induced hearing loss. This is a type of hearing loss that is caused by exposure to loud noise over an extended period of time. It can be prevented by using earplugs or other protective devices in loud environments. Hearing loss can be caused by a variety of diseases, some of which are treatable while others are not. If you're experiencing hearing loss, it's important to see an audiologist or hearing specialist to determine the underlying cause and determine the best course of treatment. With the help of modern technology, hearing loss can be effectively managed, and many people are able to improve their quality of life through the use of hearing aids or other assistive devices.